sure that many of you know, or at least have a family member or friend that knows, the excruciating pain we'll be talking about today. Today, we will be talking about kidney stones. Did you know that kidney stones can range from the size of a grain of sand to the size of a golf ball? Roughly 1 in 10 people are affected with kidney stones at any point within their life. 7% of females and 13% of males are affected. Unfortunately, I fall under the 7% of females that have been affected by kidney stones. And as anybody with kidney stones experience can tell you, they are no joke. Today, I want to inform you on the formation of kidney stones, the pain and the symptoms, and how to prevent them. So let's begin by talking about the formation. Kidney stones are formed by a chemical imbalance within the kidneys. This chemical imbalance is usually caused by an excess of calcium, an excess of oxalate, or an excess of uric acid. This excess causes the fluid to dilute ineffectively, and when the fluid dilutes ineffectively, it results in a crystal-like stone that is formed in the kidneys. Now, depending on the size of this stone, it may have to be surgically removed or just passed on its own. But either way, it's excruciatingly painful because it must come out somehow. There are no direct causes, but there are certain things that may influence the formation of kidney stones. Some of these factors include your genetics, so if you have any family history, dehydration, certain types of diets, obesity, digestive diseases and surgeries, conditions that affect the urinary system, and certain types of medications. Now we can talk about the pain and the symptoms. Kidney stones are known to be incredibly painful, and they usually affect the flank and the abdominal regions of the body. This experience is often compared to childbirth, and according to many women that have experienced kidney stones, it's not too far from it. Usually these stones do not cause pain until they are moved around in the kidneys or until they move into the ureters, which the ureters connect your kidneys to your bladder. Some of the symptoms of kidney stones include pain that fluctuates in intensity along your flank, abdominal, and groin areas, burning sensations when urinating, cloudy or foul-smelling urine, persistently needing to urinate, nausea and vomiting, and fever and chills. Now let's move on how to prevent kidney stones. Unfortunately, for some people like myself, there is no exact way on how to avoid them because you may just be predispositionally exposed to them through family history. But there are some ways you can decrease your likelihood of getting them in the future. These examples include hydrating yourself regularly, eating foods that are rich in calcium, limiting your sodium intake, and avoiding foods that are rich in oxalate. These factors also may improve your blood pressure and heart health, so they not only prevent you from getting kidney stones, but they can also affect your heart health. In conclusion, today we talked about what kidney stones are, how they are formed, the pain and the symptoms, and how to prevent them. We talked about how a chemical imbalance leads to a crystal formation within the kidneys. We talked about how the pain is comparable with childbirth and is often within the flank and the abdominal regions of the body. And we also discussed that 1 in 10 people will get kidney stones within their life. Recognizing the pain and the symptoms and how to prevent them are extremely important considering how common these are. Thank you.